Hello, I'm going to look into the current health status of Ecuador. According to the World Health Organization, Ecuador had a population of 16,385,000 in 2016. The life expectancy at birth was 74 for males and 79 for females. Their total expenditure on health as a percentage of GDP was 9.2. Ecuador is prone to natural disasters such as earthquakes, forest fires, and volcanic eruptions. Along with being impacted by the Venezuela regional crisis, Ecuador was also hit with a 7.8 earthquake in 2016 and a 4.3 earthquake just on April 16th of 2020. Insect-borne diseases are one of the main health issues in Ecuador, the most prevalent of those being malaria and dengue fever. Ecuador is also 2,850 miles above sea level, which is high enough to cause altitude sickness. Ecuador is also negatively impacted by non-communicable diseases like cancer, diabetes, and cardiovascular diseases. Like many countries, Ecuador has public universal health care along with a private branch of health. The Global Health Observatory found that 88% of the population are using basic sanitation services. 72% of deaths were caused by non-communicable diseases, while only 15% were caused by communicable diseases and maternal, prenatal, and nutrition conditions. With bad environmental conditions, smoking habits, and malnutrition, TB is one of the most common health problems in Ecuador. However, an estimated 80% had treatment coverage in 2018 with only a 9% fatality ratio. This shows that Ecuador has a successful treatment rate for TB. Malaria, yellow fever, and dengue fever are common diseases transmitted through insects, especially mosquitoes. Hepatitis A and typhoid fever are common diseases that are transmitted through food and water. While diabetes remained high in Ecuador, being 43.8% of deaths in 2017, the World Bank found that the mortality rate per 100,000 people from non-communicable diseases increased an average of 1.5% each year since 1990. Two of the prevalent factors were alcohol and smoking. However, dietary issues, high sodium intake, and low intake on whole grains, fruits, and vegetables also play a role. Diabetes and cardiovascular disease can be fatal without the proper diet. The first change a doctor will make with both diseases will be diet and exercise, which could be why the mortality rate keeps increasing for non-communicable diseases. Building off that, nutrition is also seen as a prevalent problem with Ecuador's health. Ecuador has an average prevalence of undernourishment at 8% of the population, which is not the worst. Most malnutrition is related to socioeconomic factors. The girl I interviewed also saw the malnourishment was prevalent in Ecuador, and the food they did have wasn't provided all the nutrients a healthy person needs. She also said a lot of people didn't even have running water. Food and water are basic necessities that a person needs to be healthy, and not everyone in Ecuador is receiving these necessities. Ecuador's health has dramatically improved over the years. The positive trend began in 2008 when Ecuador introduced universal health care for all residents. This increased the reliability, accessibility, and quality of public health care. In 2017, Ecuadorian public health care received the United Nations Public Service Award for being the most innovative and progressive in the world. The U.S. and British embassies even have English-speaking doctors. Private health care can be more expensive but can also be preferred by some people. This could be for many reasons, but it could simply be because of the higher quality of healthcare services in private institutions. In many countries with universal healthcare, the public coverage does not cover some specialized services, so they have to go to private practices to get those services. There is private insurance available. According to the World Bank, there are not a lot of updated statistics on Ecuador, but as of 2016, they have 2 physicians per 1,000 people with 1.2 nurses, midwives per 1,000 people. 97% of births were attended by a skilled health staff. While it could be worse, these statistics show the lack of resources Ecuador must treat the residents who may contract these diseases. These also reveal that healthcare professionals are understaffed and overworked to handle Ecuador's universal health care. While Ecuador's health system has greatly improved over the years, it still does not have the quality of care that the United States does. One obvious difference is the U.S. does not have universal health care like Ecuador. While this makes it easier to get care, Ecuador still struggles with understaffed, low-quality hospitals. They still struggle controlling many diseases like TB, diabetes, and hypertension. A big cause of Ecuador's problem is nutrition, so their approach is to fix it with obesity prevention and education for public health and dietary changes. While Ecuador has a slightly lower life expectancy and slightly lower quality healthcare, there are many things the U.S. can learn from their health system. One thing is Ecuador spends a lot less money and is still able to provide healthcare, free medications, and health education. Ecuador's citizens do not have to worry as much about medical debt as the U.S. because they do not have a direct cost for their care. There are things that need to be learned and improvements to be made in both health systems. However, it is safe to say that Ecuador's health system is continuously rising and improving healthcare for its people. Although Ecuador has implemented many great changes and has seen a lot of success with those changes, there is always room for improvement. A noticeable trend is problems with nutrition and diet. An easy way to improve nutrition is education. This could mean creating community programs to educate on the proper diet and exercise regimens. You could also start the education in schools and teach them ways to eat healthy and the right portion for foods. Since they already have universal health care, accessibility is not a problem. That means education and prevention is the next best way to fight these non-communicable diseases. It is inexpensive and easy compared to other ways to fight diseases. Another improvement is the quality of care. Just because everyone has access to care doesn't mean it is an effective care. This could mean better training for physicians, improved facility conditions, and appropriate patient-staff ratio. All these implementations can play a role in the control of communicable and non-communicable diseases that Ecuador continues to struggle with. The structure of the system is not the problem, but even with all the improvements, Ecuador cannot control those diseases. However, with the proper improvements, they can finally get a handle on these problems. To gather information from someone who has been to Ecuador firsthand, I interviewed Abby Harris, a friend of mine at Atlanta University who traveled to Ecuador on a mission trip in 2016. The biggest thing that she said stood out to her was the difference in buildings and infrastructures. Aside from that, she noticed entire pigs and guinea pigs spinning like rotisserie chicken while walking the streets. She also described the water as not quite as clean as she is used to, and that there wasn't running water available in the mountain homes. In regards to the healthcare, she noticed that although they did have hospitals and doctors' offices in the city, they were hard to find anywhere outside of the city. Compared to the U.S., where you can find pretty much anywhere, she thought that Ecuador could find a way to improve through better sanitation and bringing in and training more doctors. To wrap up, Ecuador's most prevalent diseases are diabetes and TB. Although the nutrition isn't terrible, it is one of the main factors they need to fix to help be prepared to fight the diseases they face. Sanitation is one of the more overlooked issues within Ecuador, and is something the country should seriously be looking to improve for the sake of the people in the country. Even though Ecuador isn't quite where the United States is, they are still consistently improving their healthcare systems and look to continue to do so in the future.